I really think we do have to keep in mind and make note of when patients demonstrate inferior responses to conventional chemotherapy, most notably the purine analogs. In the previous era, when we relied heavily on chemoimmunotherapy, we found that patients who had a short duration of remission or did not respond to purine analogs had a very poor overall survival, a median of 1 to 2 years in most series. So with some of the newer agents, I do think we are making significant improvements in the outcomes for these patients. And I think it relates to the fact that these agents have a different mechanism of action really across the board. I've already mentioned ibrutinib and idelalisib. In the clinical trials, we have seen improved outcomes for patients with specifically fludarabine or bendamustine refractory disease. I think there are several other important options to consider. Some of the non-improved agents, lenalidomide has demonstrated responses in these patients. While it's not approved and hasn't been as heavily studied, this can be an important option for refractory CLL patients. Alemtuzumab with high-dose steroids has demonstrated somewhat promising outcomes in these difficult-to-treat patients. I do think when using such a regimen, you really have to be attentive to side effects. But I think perhaps one of the other most important considerations in patients with any number of high-risk markers, especially having poor responses to standard therapy, we really have to consider our clinical trials. It wasn't that long ago that ibrutinib and idelalisib were only available on clinical trials, and we saw dramatic responses in patients that previously really had no other treatment options available. So to see patients get good benefit while taking pills and return to their previous quality of life really solidified in my mind the importance of clinical trials. And moving forward, to see similar dramatic results from the BCL2 inhibitor venetoclax, as well as a number of newer agents that we would consider in the B-cell receptor inhibitor class of agents, as well as completely novel strategies giving patients benefit. I do think we really have to, again, weigh those risk factors, including when patients are refractory to chemotherapy.